Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Dr. Ruiz.
Hello everyone, super excited about my guest today. My guest today is Maria Inoa. Maria is a licensed clinical social worker, public speaker, and owner of Full Potential Counseling, where she provides both in-person and online counseling. She specializes in working with women to build healthier relationships with themselves and others. She's especially passionate about helping women heal from past trauma and is trained in EMDR therapy. In addition to seeing clients, she enjoys speaking on various topics related to mental health and women to help end the stigma surrounding mental health issues. This is a very important show since we are suffering from so much anxiety and fear surrounding this global pandemic. Also, I will be releasing season 1 of my show on May 19th. This first season will be 10 episodes, and you can listen all at once or just pick and choose which one interests you. I have some pretty cool guests this season. I can't wait to share this with you, and I hope you enjoyed this show. Hello everyone, super excited to be here once again, trying to give you some good information with all of this stuff that's going on. I am honored to have my good friend, Maria Inoa. Maria, how are you?
I'm good. I'm really good. Thank you.
It's been crazy time, it's been a crazy time. And what better person to have today than someone who specializes in mental health? So, Maria, for anyone that's listening, what's your hero story? How did you get into this field?
I pretty much have wanted to be a counselor of some sort since I was probably late high school. I went to my own counseling just for various family stuff and just, really being a teenager and the struggles. And so when I went to college, I started on the path of psychology, ended up switching to social work and then going into a master's with clinical social work and getting my license. And I just have, from early college, I've just really enjoyed the therapy and the counseling and helping people from that perspective and being that support and that guidance and just helping people to their healing, whatever that might be for them.
Now, I know you specialize in trauma therapy, and, we'll get into it towards the end of this interview, but we hear a lot of people on social media and we see a lot of posts of people struggling with this and being inside and not having someone to reach out and not having someone to kind of like unload all this anxiety. So I wanna divide this interview in 3 places. I want to talk about what can you do for yourself, because we always hear you have to put on that mask on yourself before you can help others. And then I want to talk about little kids, teenagers, and how can we transition them or guide them through this awful period. And then finally, different strategies and things that you're doing for you and your family to help cope with all of this. But with that concept of you cannot help others unless you help yourself. How can each family member or each head of the household help themselves so they can be there for their family?
So I think, people pick up on your energy, right? So if you're the mom or the dad and depending on whether maybe you're still working, maybe you're at home, a lot of parents are having to be thrown into this homeschooling thing now. Some people are working from home. One of the things I talk with people about when I'm getting this question is this idea of trying to keep this normalcy and having some sort of a schedule. And even if it's obviously going to look different because we can't just go places, but the things in the schedule that make sense, that make you feel there's a normalcy, even as simple as I get up every morning and I change out of my clothes. Maybe if you're working from home, for example, or even if you're not working from home, but just changing out of your pajamas can do a lot of do wonders for your mind. Even things like as making your coffee in the morning. If you're used to making your coffee in the morning, it gives you a sense of normalcy. So, having some sort of schedule during the day, not so so specific that it has to be hour to hour or anything crazy like that, but that you have a sense of structure. You don't feel like you are, because there is this sense of so much uncertainty that it's like, what are we doing? What's going on today? It's just a weird time. So having some basic structure in place for meal times or different things like that, and when you're planning to get up, and when you're trying to go to bed, and little things like that, I think make a lot of difference for our mindset and feeling some sense of normalcy.
It's funny you mentioned that because, I've talked on my podcast before that on my regular day to day, I don't check social media and I don't check my emails up until like around 9 o'clock in the morning. And with all this craziness, I have been, straying away from that, so that's, having a good schedule is just so important.
Yeah, and the social media and the news thing, people get on that loop. And it's like, it's great, right? Because, I think especially the news is one thing. You really just need the news and snippets. Nothing's going to change that much day to day right now. I mean, you want to know what's going on, but you don't need to watch it over and over again because it's just depressing. And to me, it really just breeds this sense of depression and anxiety. But even with social media, it's great. I mean, everybody's got these memes and you're connecting, and social media for, a lot of purposes now is the way you connect to people. But you get on this like loop of scrolling and scrolling and scrolling. And it's like, okay, you're just sitting there scrolling. And it's like, just, you need to get up and do something different. Limit the scrolling, limit the news as best as you can, because again, it's like, there's only so much you can get out of social media if you're just scrolling and not actually communicating like in an actual message kind of situation.
Now I'm going to put you on the spot because your husband, one of my best friends in this world and a person that I love dearly, he's on the front lines. He's going to the hospital, and I think the responsibility of safeguarding your house has a little bit fallen onto you. So what are some things that you are doing to keep yourself together and to put this into a perspective that you're helping and also protecting at the same time? Because Tony, he's a nurse and he's going to the hospital every day. And I imagine that there's a lot of anxiety. I'm not sure, but what are you doing to build yourself up, to have the courage to go through this time?
Well, I think I don't let myself think too far down that rabbit hole of, well, what if, and how many people has he dealt with today? And because you don't see it, you can't see it, you don't know. I think there's so many unknowns. And because this is so unprecedented, I think that even for him and his superiors, they're just sort of like, sometimes he says it changes day to day based on what the CDC says. So I really try not to like play into that, but just do the basic things of like, vitamins and anything immune boosting. But for myself, like in the morning, I really have to put on the positive, like think of the positive in the morning. And like you said, like try not to look at your phone right away. It's really hard. But trying to start off with a positive mindset, because that's going to immediately reflect onto your kids. They're going to sense that energy. They're going to sense if mom's grumpy, mom's irritable. They're going to go play off of that. So I think really trying to find the positive in the morning, what you're thankful for, what during the day you can do that makes you feel good, makes you happy. I myself have been trying to take time, even if it's like a few minutes, to just like pop in like a quick guided meditation, because there's like a bazillion apps, and just to stop and breathe and kind of get myself in a good place, especially if I'm starting to feel that like just the fear, the anxiety start to ramp up. Sort of being in the house, most of the day and homeschooling. So I really try to take time and just stop and breathe. And if my kids see that, it's even better. And I just let them know mommy's, just practicing her breathing. It's a good thing for them to see anyways of how you're handling, the kids are going to learn how you handle the stress and what you do with the different emotions, through this.
A question that I've heard a lot, or, a meme that you've seen, is a lot of people, making jokes about drinking and, in 5 o'clock somewhere, or, all these things. Being completely honest, I drink. I love my bourbon. What do you think about having a drink? How would you self-limit, or how, what kind of boundaries would you put on something like that?
Okay, so I think that the best thing with this is self-awareness. For myself, I do like to have a drink sometimes. I'm not really a big drinker, so I don't really care that much about it. But I know I have clients, currently past that, a lot of people don't have that. They don't know, they can't just have one or two, because one or two, turns into a lot more. I think a lot of it is knowing yourself and knowing that, okay, what can I do? What can I do today? And honestly, I feel like limiting it as best as possible, because, you're stuck at home. For most of us, we're stuck at home drinking, and there's not like an outlet where you're going out and you're going to be around friends and have that distraction of that social interaction. I think a lot of the drinking is probably done in not the greatest circumstances right now, like, watching TV, watching the news, or just kind of like binge watching whatever. So I think people have to, one, know themselves, and two, just be very careful, because it's a slippery slope right now. And I'm always like, what other things can you do instead? If you feel like reaching for something, what can you do? I mean, even if it's something like like a supplement for anxiety, or something to help ease it, like a CBD oil or magnesium or something. But what are you reaching for that? Is it boredom? Is it anxiety? And is there an alternative that you could try to lock into during that time?
Yeah, and it's easy, because we're home, you don't have to drive anywhere. Drinking is fun, but we have to be very, very careful, because the circumstances are different. It's not your typical afternoon anymore.
Right.
So you said, ask yourself, is it boredom? Let's say you say, okay, yeah, I'm bored. What can you do? How can you reframe your mind?
Well, if you're bored, I would say, what are your options in your house? What do you enjoy doing? Can you talk to somebody in your house, like if it's like your significant other or spouse, or engage in a game with one of your kids, depending on what time of, day it is? Can you go outside and just get some fresh air and say, like give yourself, even say like, hey, in 15 minutes, I'm going to see if I still feel like having that drink. Or, again, not that it's bad to have one, but if you feel like you're struggling, I think getting outside, getting some fresh air, doing some sort of movement or exercise within the confines of what you're able to do in your living situation. But just other things, like, do you enjoy reading? Can you put on some music? Can you just sort of get up and change what you've been doing? If you were sitting there, or if you were in the kitchen, can you go to another room and just see if you can sort of, I guess, distract yourself in a lot of ways, but just engage in a healthier activity?
And then with anxiety, we talked about different things that you can do, such as a little bit of GABA, or a little bit of magnesium, or a little bit of CBD.
I think anxiety, a lot of times people run from that feeling of anxiety. And I think, again, doing some sort of breathing. I've mentioned these guided meditation apps a lot in sessions, but it's because we don't do very well. Most of us don't do well slowing down and just, let me just stop and breathe. It's very foreign and it's uncomfortable for a lot of people, especially if you do have anxiety already, and then you have the coronavirus on top of it. So, trying to find the time, even if it's like 3 minutes or 5 minutes, or if you can do longer, that's great. But, putting in some headphones, maybe putting on a guided meditation, just even like soundscapes, ocean waves, whatever makes you feel relaxed, and just trying to breathe, not necessarily not trying to think, but just focusing on, I'm just going to breathe right now. I'm just going to take some good cleansing breaths. And that's really important for people with anxiety, because you get on this loop of your head, and the thoughts, you think more almost to avoid that, feeling the anxiety. So you're like, well, how can I fix this? Or what can I do? Or what's going to happen? And so you get on this loop, and it's like, if you just can try to stop and feel it, because you're not going to probably like implode from it. But if you just stop and just try to breathe and see if it'll just pass over after a couple minutes. A lot of times it will, but we don't give it a chance. And we just kind of like, and then we can get panicky and go down all that crazy stuff too.
A big thing that we need to completely understand is that we need to practice physical distancing, not social distancing. So, calling your friends, FaceTiming your parents, FaceTiming your siblings, that's very important too.
Yeah, I definitely agree. I think that makes you feel, again, that normalcy makes you feel like, okay, I can see them, I can hear them, talk to them. You feel better. You do feel that connection. It's not quite the same, but it's still definitely connection. And it makes you feel, you're seeing the people you love. So, you feel better. You feel more positive.
One thing that I've experienced personally is, we went for some groceries and we ended up going to one of the big box stores, and it was very well managed, and they were only letting so many people in, and we washed our hands and everything. But I got home and I was like, oh man, I think I'm feeling sick. I think I got it, and I kind of tried to keep it to myself. I didn't want to tell Megan that I was feeling a little bit anxious. Eventually, that fear went away. And then she told me that, she felt the same way. What can we do to prevent that anxiety, or how could have I managed that better?
On one hand, I think it's so normal considering the situation that it's normal to have anxiety. It's normal to be fearful to an extent, as long as you don't let it sort of like snowball into something where it's affecting your functioning. So I think that it's okay to be, because it's so bizarre to go to the grocery store, and even here in Florida, like the stores I've gone to, they don't even do that. Some of them are just like letting as many people in, and it's just there's like not even the social distancing, so you don't really know what to do with people. And then some people are wearing masks and some people aren't, and there's gloves, so it's just a bizarre time. I think that going into it, kind of getting the mindset of just preparing yourself that, whatever you're going to get, we're going to get in, that you're going to be okay, right? Because I think that, and this kind of comes from talking to my husband, like it's kind of everywhere. It's not that it's not in the grocery stores, it's there. And I think there's a sense that the better you take care of yourself, from what I understand from the healthcare providers, the better that you can hopefully fight it off. So I think that for some people, it's just not even going to the stores, and they use sort of those services that bring it to you because the fear is there for them and they just don't even want to chance it. I think that the self-talk in your head, it sounds really simple, but never is. It's just sort of like talking yourself down from that ledge of like, it's going to be okay. We're going to be fine. We know we're doing this X, Y, and Z, taking care of ourselves. Remind yourself, I think, of the facts of sort of the coronavirus, not necessarily like what sometimes the media tries to hype it up. And like, it's not that everybody's getting sick and, everybody's not dying. It's not like that at all. So I think if you can have that self-talk to assure yourself that it's going to be okay, that you're breathing, because as soon as you start to get that anxiety, typically the breathing becomes more shallow and you're not getting the oxygen to your brain. And then it just has that ugly sort of cycle that you get into. So I think talking yourself down from the ledge, reassuring yourself, telling yourself it's going to be okay, breathing. And then again, I think there's just going to be that level of anxiety and fear that's just there. That's just, I think the situation warrants it. I think if somebody was like, oh, I'm not anxious or fearful at all, I would be like, really? Not at all? Like, even a little bit. So I think it's just normal to an extent. But I think you just have to breathe yourself through it, have that good self-talk, reassure yourself, pay attention to the facts, not what you're just necessarily seeing on the news or social media.
Yeah, and you're right, like being completely fearless, then you start seeing a little bit of like risky behaviors, and that's dangerous too.
Yeah, I agree, definitely.
Okay, so, okay, I don't have any kids, but you do. How would you frame this, because like my little dog, my Arrow, she was very confused for a couple of days, where even her digestion started suffering. She was having a little bit of diarrhea, and she was uber aware, and she was like being a little bit needier than usual. And doing some doctor googling, myself, I found an article that talked about how dogs can perceive our emotions, and I think she was just having a little bit of like mirror anxiety. I can't imagine with having little ones like you. How do you talk to them about this? What are some strategies that you're using to make sure they're informed, the reasons why school has been canceled, or why they can't go to the park, and at the same time being emotionally healthy to where you're not giving them nightmares and stuff like that?
I think you have to give them some information, but not too much information. So for like my youngest one, my 3.5-year-old, so, she's only going to understand so much. So I kind of told them together that there's something called, I gave them and told them the name, the coronavirus. So I think it's important that they know what it's called. But I said it's kind of like a flu, like a really bad cold. And so my 3.5-year-old understands that, and just she'll say, oh, can we go someplace? And I say, well, no, sweetheart. Oh, because we can't, because the flu. And I said, yes, we can't go because of the flu. And so I feel like they kind of still think it's like a vacation sort of thing. I think they miss their friends, but it's still like not so bad. I think that maybe because of just trying to kind of create that positive environment in the household and not to let any anxiety that I may feel roll onto them. Like you kind of were saying about that mirrored anxiety. I think I have said, like, some people get sick from it. My other child is, as you know, is like 6.5, almost 7. I don't think you ever need to say anything about people dying unless you happen to know someone and need to tell them. I think they need to understand that that is not common to the situation. So I have just basically said that this is a really bad flu. They haven't really been out. They went to the grocery store once, and I said, people are wearing the masks. I said, just to be extra cautious. I just try to tell them that, like, we're staying inside. We can't go to so and so's house, but we're just being extra cautious because we don't want any of our germs to get over on them and their germs to get on us. And everybody's just being really careful until the flu passes. And so that's basically how I'm handling. I think as they get older, depending on your child, I think you have to know your child and their maturity level. But I think if they get into, like, preteens and the teenage years, you can have more of that conversation about maybe a little bit more of the realities of what's going on. Now, if you have a child that's more prone to anxiety, I probably would still very carefully tell them. I probably wouldn't necessarily talk about the deaths or anything like that. But at any age, let them know, like, I try to say, if you have any questions, you can always come and talk to me. I think if they know that they have an open floor, that as their little brains are processing and trying to make sense of it, if they have questions, they can come. There's that open connection with mom or dad or whoever, that they can come and talk to you, and they don't have to be scared to or anything like that. And that way they can continue to process it, because you can, little ones, you give them the information and then they're like, okay. And you could almost see the wheels turning, and then they may come back later and have a question about it or try to understand it, a little bit more. And so I think just being open to those conversations as this continues on, and, a lot of kids probably will not go back for the school year. You're going to have the conversations again. So it's kind of being like an ongoing conversation, I think, that we're going to be having as parents, considering the situation sort of unfolding as we go.
Are your kids prone to anxiety?
I would say my daughter, Mila, is. She has about like a million questions every day, which is great. I just try to always, answer them. But she is just, I think, really smart and tries to understand. But I think I've been really careful to not make it an anxiety thing, but more like when I say it, I don't make it like, well, we've got to stay inside, but more like, we have to stay inside because we don't want to spread germs to somebody else, and somebody doesn't want to give us their germs. So everybody's being extra safe and careful, and we're just being, kind and making sure we stay apart right now. And I think that tone, and again, the anxiety that we can bring as parents, and even if we are feeling anxious, that's okay, but try not to let our kids see that. That's where you might have to take a moment, step away, get yourself calm, get yourself centered, do some breathing, and then come back, because if they pick up on that, they just, they just don't understand. And you can also have the conversation. I think if you are feeling anxious, you can say, well, I'm just a little anxious because you're not going back to school, or mommy's trying to balance, mommy's trying to do her work from home and we're trying to do homeschool. And sometimes it's a little bit much for mommy. I'm always a big fan of parents having a level of honesty about feelings and emotions, because kids are going to learn the emotions from us. Oh, mommy's angry. If I get angry, I tell them mommy's feeling, mommy just feels really angry right now, or mommy's feeling really frustrated, because they watch and see what you do with it. And that's how a lot of times they learn, is how what mommy and daddy do when they're angry or they're anxious.
Let's say your 3 or 4-year-old wakes up in the middle of the night and they're having a little bit of, an anxiety attack or a nightmare because of what's going on. What would you do? How would you help them get through it?
In the moment, I would just comfort them and reassure them that everything is going to be okay. It's kind of like, I think about a little bit like when my kids, if they wake up and, they had a bad dream about whatever it might be. Well, there's no such thing as monsters. Or, like, I just think we're reassuring them that we're going to be okay. We're doing the things that help us to stay healthy. It might be a really good plug to get your kids to eat more vegetables and fruits, because you can be like, this is helping us stay healthy. So eat those fruits and vegetables. But I think just the comfort and the reassurance and that security that kids get from, their parents is the biggest thing. If you have a conversation maybe the next day about if they remember the dream, if they want to talk about it, again, allowing them to be able to talk about it so they can kind of be able to put words maybe to their fears and their anxieties, or you're giving them the floor to try to put some words to it, and then just talking it through, that validating that it's okay to feel anxious or it's okay to be fearful, but everything is okay. You know, that mommy and daddy are here and we are being, we're doing a great job and we're being safe and we're being careful and we're washing our hands and just those little things like that, I think help to reassure them.
So giving them tools, that's great. Giving them tools like this is what we're doing to keep you safe. It's like, when kids, I'm no expert, by the way, when kids don't want to eat like healthy food, a strategy would be to bring them into the kitchen and have them help you cook. They're going to be more prone to eat that food because they helped. Same thing with this, teaching them that, okay, this one thing that we can do is that if, we wash our hands, or if we went outside, we take off our shoes outside of the house, and just guiding them and making them feel part of the team.
Yeah, and we even started doing like little, like using some of the guided meditation apps have those little like kids areas, and we even started with them just before bed. I mean, this is good for any time, but what a better time to start than during all of this is to have them just do like it's like a 3-minute breathing exercise, so that they start to learn how to regulate, how to self-regulate if they start to feel whatever it might be, a negative emotion, and that way they can start to learn to breathe themselves out of it.
So that's for someone, that maybe doesn't have a screen, they're pretty much in a sandbox when it comes to the amount of information that they can see. What about your, like 12-year-old, your preteens and your teens that they might have a smartphone and they are being, bombarded with this information? How would you frame it differently? Because now you don't have control of what they're reading. You might have a little bit of control, but how do you talk to them about this on a daily basis?
I think that openness of communication, that if you can have that open channel with your preteen and teen, is super important, because if they feel like they can ask you something or bring up a topic and you're not going to have some sort of negative reaction, then they're going to be more likely to do it. So if they're feeling maybe a little fearful, a little anxious, a little scared, the idea is to let them have that openness. They can talk to you. So I think it's good for parents to even check in and just say, how are you feeling today? How are you feeling with everything that's going on? And just seeing where they go with it. I think a lot of it is knowing your child. And, if your child is a little more anxious, you might be able to kind of hone in and ask certain questions because you know them. But just how are you feeling? How are you feeling about everything that's going on? Have you read anything interesting, or you read anything that stood out about the situation, the coronavirus, or is there anything you have questions about? I think it's really important parents, that's a whole nother thing, but monitor what they're listening to, what apps they're on, because they might be getting like misinformation too that they're reading, and they may be thinking. So I think it's great to have those check-ins, because you might find that they think this is what the coronavirus is, or this is how you get it, and that's actually incorrect. And then they're sort of having anxiety about nothing, that, it's not even, it's false. So I think asking them questions, how they're doing, if they anything they want to talk about, they have any concerns about what's going on, just kind of any of those questions as open-ended questions that allow them to have space to respond, to ask questions, to express themselves. I think that's really important.
When I grew up, we didn't talk about this kind of, we didn't talk about feelings in my family, very, very traditionally Mexican family, everyone just keeps quiet and everything is fine. Let's say, you are a teen in a family like that, or you're a mom and you want to open those channels. What kind of questions would you use to open those channels? How would you present this conversation? Because, hey, we're quarantined. This is the best time to do something like that. This is the best time to start to open the communication and maybe connect with your kid if you haven't.
One way, especially if a family's not so much used to all that kind of, touchy-feely stuff, is maybe like to play a game, a board game, a card game, Uno, because that gives everybody something to do with their hands and kind of gives a little distraction. So it's easier to bring up stuff then, because they are, they're doing something, and it's sort of easier for them to it's easier sometimes to get the conversation flowing, because you're doing something that's more of like a fun, a relaxed activity. And then, hey, let's just, hey, how are you feeling today? Or how are you feeling about all the stuff going on? Or how's your best friend, Joe, or whatever, Susan, doing with the situation, and even sometimes depersonalizing it and saying on somebody else may bring it back around to how they're feeling if they're, not really used to expressing themselves if maybe you ask about their friends or their families, sometimes that is sort of like a back door in to let them end up expressing sort of what they're feeling in a way.
That's great. And unfortunately, with all of that's going on and with all of the things that we're exposed to and the outcomes that we're seeing, there's going to be a lot of trauma. There's going to be, a lot of mental health issues. One thing that I read is that spousal abuse, has rocket, because women are now at home or even kids, who were using school as an escape. Now they are trapped. And unfortunately, this is something that unprecedented. No one ever even thought about this, but this is something that we're seeing. We grew up through 9/11. We grew up through financial crisis. We grew, you guys, it affected me, the Orlando events, and so many different events that have happened, Can you define to us what is trauma and what are some signs and symptoms and who would qualify, or, maybe you never thought about this and maybe this anxiety, the signs and symptoms that you're exhibiting that you haven't put a name to, they could be trauma.
So trauma, that's a tricky one to define. And I would say personally that trauma is how you process negative life events. Because the thing is that we might both experience something, but the way we process it and how our brains process it could be different. And then I could end up maybe struggling in some ways down the road, and you may not have that at all. So I think, trauma doesn't always mean that you have PTSD. Research has shown, as the trauma, I love that the trauma field has grown so much and there's such amazing work going on in the things that, I have learned and read about, that there's this idea of the small T traumas and the big T traumas. So a lot of times people only know about the big T traumas, which is like, if you were like, any part of like 9/11, for example, or if, you think sometimes people think trauma is like, I had to have the coronavirus, for example. And then, but if that was my spouse, or if that was my brother or sister, like, well, that doesn't count, but then it does count. So that you can be traumatized if your loved one went through a life or death situation, and they call that like a post-secondary trauma or PTSD. But trauma doesn't always mean that you have to have a full-blown diagnosis of PTSD. It's more or less that there's all these life events, like these negative life events we go through. Like right now, like you mentioned, there's a lot of trauma going on. And sometimes people who have been through trauma, this can trigger it in different ways. So it's just kind of a mental health, I think, mess in a lot of ways. But the fact that people are losing their jobs, whether you're still getting paid, even if you're still getting paid, just the fact that you're at home, if you're someone who's used to working and there you're home with your 4 kids and your wife or whatever, it's like that can even be trauma, a small cheap trauma for some people. But the whole financial stress of right now is trauma. It just depends on the person and how they interpret that event. And, sometimes there's anxiety that comes from it. Sometimes it's depression. I think a lot of times it's bits of that I see in people that come to me, and the trauma has happened however many years ago, and they're sort of removed from it, like the detached from it. It's really interesting to me, but it's still affecting them because it's there on the inside. It's just that in their head, they have moved past it and they're over it, or they don't think about it, or I don't want to go there, but it's still happened and is still in them. And so a lot of times people struggle with something maybe kind of unrelated to the trauma, but it's because the trauma has never been healed. There's that connection to it, if that makes sense.
What kind of symptoms can someone express? You mentioned anxiety. Can you have like physical symptoms too?
Yes. I mean, PTSD symptoms are a whole nother slew, and there's a whole lot of them. I almost would probably need to look them up, but it's PTSD is being in that life or death situation, experiencing it or witnessing it. And so you can have a lot of different things that come from it. There can be the physical symptoms of, it could be have flashbacks. You could have your startle reflex. Sometimes people are hyper vigilant about something because it's something that relates to their trauma. You can have angry outbursts, your moods are affected, you're irritable, you are triggered by even the littlest little thing that for you relates to the trauma, a place, a smell, of course, a person, even sometimes your body sensations, it just all connects to that trauma, and you have this whatever negative response that can come from it. Of course, nightmares can be part of it. There's so many to the actual PTSD criteria. And then it's a little bit different for like the younger population, the kids and things like that. So that's why I say with trauma coming in, it's almost sneaky in the way, which I think anxiety is sneaky anyways, because you don't necessarily know people have anxiety because a lot of times they internalize it. But a lot of times it's people coming in and they're experiencing, not necessarily have a diagnosis, but there's some sort of anxiety or there's panic involved, or there's, some level of depression and sadness, lack of motivation, lack of energy. They feel stuck. They have low self-worth. They have all these things that kind of mix in there. And then as we go back, and we see that these things have happened, they usually don't recognize them as being trauma. But a lot of times that's what sort of, you're just kind of carrying the weight of those negative life events. And then it's just got you to a place right now where you do feel stuck, or you're just not sure even like who you are or where you're supposed to go. And you just kind of are lost.
Can you, that sounds like so deep and complicated. Can you recover from it?
Yes. So I personally, I'm very careful with trauma, people who have trauma, because I think that therapists can really do more harm. So I do EMDR. I'm trained in EMDR, which is eye movement desensitization and reprocessing. And I don't know if you've heard of it, but it's from everything I've seen, it's like pretty much the number one trauma treatment. There are other things as well, but it's not a talk therapy, but it's a way to heal and allow your brain, basically to start your brain's ability to heal from trauma using bilateral stimulation, the right brain, left brain. A lot of people think, if they typically have kind of know anything about it, that the eye movement, you have to move your eyes rapidly back and forth, but you don't have to even move your eyes back and forth as long as you're there's a right and left brain stimulation. So there's kind of like different ways that people can do it, but it allows the person to not have to talk about the trauma. They can if they want to, but they do not have to go into detail, because that's how talk therapy is sort of set up for trauma in a lot of ways. But with EMDR, it's not required. So it's a lot more of a welcomed sort of approach for people with trauma, because, nobody wants to kind of go into therapy and oh, great, I get to tell the story again, or you're going to ask me all these details, and I really don't want to talk about those details. There's like 8 phases to it. It's a very, you're supposed to follow the protocol. That's how it's effective. It's been around for 30 years, but, amazingly, a lot of people don't know about it, but it's 80 to 90% effective. And they really start using it a lot of times for like full-blown PTSD, combat veterans, and they found that it was really effective. And they found that it is effective for things like anxiety and depression, can be effective for grief and phobias. It just depends on the situation and what's creating the problem, the symptoms, whether it's anxiety and depression. But a lot of times I find that anxiety and depression does relate to stuff in the past. You know what I mean? A lot of people don't come into me and are just like, I haven't had anything bad happen to me. A lot of times you can trace it back to some things that sort of like gunned that anxiety and that depression or started it off. So I do the EMDR off of that. I love it because it's just such a really cool way to treat people with trauma, and for them to sort of allow their brains to heal itself, and it's sort of like I tell them, like, your brain wants you to be healthier and happier. So we're going to just basically like start the engine so that your brain can start reprocessing all these negative feelings and memories into something that's more of a neutral thing.
It's funny. It's almost like our body wants to be healthy.
Yeah.
I feel pretty confident that if I was to get this infection, I have done enough of the back work that I would be pretty, on that outside of that 0.082% of people that end up on a respirator. Hey, someone said it the other day, that doesn't mean that I'm going to go out and expose myself. It's like if someone gave me a bag of M&Ms and said 2 of them have cyanide, I would say, you know what? I'll pass, because there is a chance that I picked the wrong one. But in the case, I think I'm pretty well prepared for this. And doing all of this stuff, my body wants to be healthy. My body wants to divert to the healthy pathway. Same thing with your brain. But sometimes your brain does get pretty confused and injured. And EMDR is a way of rearranging your brain in order for you to have that healthy brain and that fulfilling life in all of these things. So when can you start EMDR? Like let's say, after all of this is over, do you have to go, through a diagnosis process where people have to have, either this little T or big T trauma or even PTSD before you can do something like this?
I think if you have a therapist and they know what they're doing, they will be able to tell you based on what you're coming in for. A lot of people that come in have never heard of EMDR. Sometimes they do, and they specifically are wanting to start that. But I think that if someone's coming in, a lot of times they're coming in for anxiety and depression. I get, that's of course very common. As we're talking and I'm getting their history and I'm finding out what's going on and what they've experienced, I a lot of times will say, you've had this trauma, this stuff going on, this, and trying to do that kind of psychoeducation piece that some of these things are trauma or can be considered trauma. And hey, there's this approach called EMDR, and totally up to you, but here's why I think it would be helpful. There's so many people that it can be helpful for. And then there's some people I see that I don't use it for because they don't have, they're either not interested in it or they just don't, it's not really what they're presenting with. They don't have a lot of significant trauma. Sort of the issues that they're addressing aren't going to be necessarily best helped by EMDR, at least at this time. The person does have to be ready for it because even though you're not talking about it, the emotional, it's going to take some emotional energy, some mental energy to do it, which I think therapy does anyways, but EMDR really does. That's why the EMDR protocol is set up in a certain way so that in the initial phases, I sort of gauge the person and what they need to be ready, or if they're not ready, perhaps, and what they need to be able to be actually ready for that meat of it, the reprocessing, which is the fast bilateral stimulation. So I think it just really depends on the person, their situation. Because I always want to know what the person is here for. Like, I might have my ideas, but if you're like, I'm not on board for EMDR, I really just want to do this, then that's what we're going to do, at least for right now, and try to get you to your goals. So it's really just honoring, what that person is wanting to do and their goals for sort of the counseling process as well.
What other tools do you have for, let's say someone says, oh, this is BS, I don't think this is real or whatever. What other tools do you have for someone that wants to work through their trauma or they've tried EMDR and it didn't work for them?
Okay, so if they've tried EMDR, like if someone comes into me and they've gone to counseling, I try to find out what they experienced because, like with any profession, there's, some people that do things that are a little bit wonky or they do things that are great and like, hey, this really helped me. I totally forgot about, I did this with this counselor. I should start doing that again. So I try to talk to them about, well, what was it like? What was your experience like? What did you like about it? What did you not like about it? EMDR, I haven't yet met anybody that said it didn't work for them. If they didn't stay with it, it's possible, but that's how it is with counseling in general. It can get hard and people will run because they don't, it's hard. It's hard emotionally. So, if someone's not doing EMDR, we do a lot of different things. I do a lot of I do some like cognitive behavioral work. I love the idea of mindfulness for, anxiety and depression. It's looking at building sort of their emotional toolkit. What's going on? What do you need to cut out that's maybe just weighing you down like an anchor? What can you add into your life that can help you cope better? That, for example, more like anxiety and depression stuff, but like what can we add in? What can we experiment with and try out? A lot of times it's just through that talking and the processing that we can kind of discover these different things that might be able to help them. I do try to have people try things in between sessions because if we only meet like an hour a week or every other week, I'm trying to give you the best bang for your buck. If you can work on such and such in between, if you're on, long as you're on board with that, let's do that. Come back. We'll see how that went. And then we'll go from there and keep going and just try to build momentum to see what pieces to the puzzle that you need to help for you to feel like happier and healthier, lower the anxiety, work on the depression, get that, at hopefully a lowest level as possible. Sometimes I see a lot of women, so it's a lot of self-worth, identity issues. So we're trying to figure all that out and make feel better about themselves and have a grasp of their identity. So those are some of the things that I work on. That's besides like the EMDR piece. Trauma, I don't really get into a lot of if I don't use EMDR, because I think you have to be careful. I think you have to have, I don't think regular therapy is always really great for trauma. I think you really have to have some different approaches to address trauma. That's myself. I just have always been very cautious of trauma, even though I've been doing counseling for like 15 years. Until I did the EMDR, I wouldn't really get into the trauma. If they had trauma, if that was the biggest thing, I would try to refer them out, or, but I wouldn't want to open up that like Pandora's box and be like, oh, okay, I don't want to do that to them, because that's just doing more harm, I feel like.
Has your practice changed since the past 21 days? Are you seeing a little bit more anxiety and less depression?
Yeah, anxiety is just definitely the number one thing that's coming up for people. Just anxiety and adjusting and just sort of processing it as it changes, even like week to week, and as I see them, or every other week. And it's sort of like, okay, so now we're, like in Florida, now we're like in the shelter in sort of thing. It's like this progression. And then some people are like, they had their jobs, but now as it's going on, okay, well, we're going to have to lay you off or whatever for right now. So they're dealing with that. So it's kind of like this ever changing thing. But the anxiety and the uncertainty is like for sure number one that I'm seeing right now.
Some parting thoughts, what would you say, to everyone right now? If you had a soapbox, what would you recommend, or what would you say?
I would just say, I say this for a lot of the women I work with, a lot of them are moms, but this is really for anybody. It's just to not set your expectations too high. On certain days, sometimes we're trying to do all the things, or we're trying to do for work from home, maybe homeschool, or maybe do this and try to keep our fitness schedule up, and we can't even get to the gym. And sometimes we put too much pressure on ourselves. So I think you just need to not be so hard on yourself, because this is such a difficult time across the board. No one knows what's going to happen next week. That to just be good to yourself, be kind to yourself during this time. If you feel anxious, it's okay. If you feel fearful or panicky, that's like part of the normal human range of emotions. So it's okay that you feel that way, to not beat yourself up because you're not jolly and happy, every day of being quarantined. It's just to be good to yourself and have like regular check-ins that what do I need right now? And what do I need, what do I need during the day that maybe I'm missing, to kind of help myself feel as good as I can feel in the situation.
That's awesome. Thank you so much, Maria. How can people get a hold of you? How can people contact you if they want to work with you? Do you have a website? What's your social media?
Sure. So my website is fullpotentialcounseling.com. And then Facebook is Full Potential Counseling Jax, JAX, because I'm based out of Jacksonville, Florida. And then Instagram is full_potential_women. If you are in the Florida area, I am happy to do a consultation, a free consultation by phone, and we can make sure that I'm a good fit for you, that just kind of talk through some of the things that you're going through, and to make sure that, the telecounseling, the virtual counseling is going to be the right fit. But they can definitely do that. They can reach out to me, and we can schedule that, no problem, through my website. Probably is the easiest way.
That's so awesome, Maria. If you guys in Florida, we don't know the legalities of like across the, the states. But if you're in Florida and you know someone that might benefit from seeing someone that specializes in trauma, someone that is teaching this stuff and going through this stuff and actually has some good knowledge base on how to deal with an emergency like this is a great opportunity, because I think everyone needs to work with a counselor. Everyone needs mental health. So what better way to, just talk to someone, even if it's just 5 or 10, 15 minutes, and see how they can help you. Thank you so much for doing that, Maria.
Thank you so much. Thank you for having me.
Oh, excellent. So thank you so much, and I'll talk to you soon.